There is a well-documented link between mental illness and homelessness. The U.S. Interagency Council on Homelessness reports that 70% of the individuals experiencing chronic homelessness also suffer from some form of mental illness. While the problem is well known, solutions are harder to come by. In Mississippi, a program called Choice works to address the problem by providing temporary housing and a path to recovery and independence. Choice stands for Creating Housing Opportunities in Communities for Everyone. It is a state-funded program developed by homeless service professionals. The program uses evidence-based practices to provide housing and community-based treatment for people with a history of mental illness and homelessness.
It is very difficult to address mental health needs when someone is unsheltered. It's a major stressor for the individuals that we serve. So until we can get stable housing for them, it's very difficult to treat the underlying mental illness.
I mean, it's just an impractical situation for people to be able to access mental health treatment when they're concerned about daily survival.
Open Doors Homeless Coalition administers Choice in the 6 southern counties of Mississippi. Their case managers coordinate stable housing for eligible clients. This creates an opportunity for them to seek treatment from area community mental health centers.
And if an individual is unsheltered, then they are not going to get well. So you have to really work as a team to get the housing in place before you're able to address the mental illness and the substance use.
Once an individual is housed, Choice provides wraparound services tailored to their needs.
It's not just housing, it's not just mental health treatment. It's a combination of it all. It's brought together and wrapped around the individual, which gives them the best possible opportunity to succeed.
Choice provides supportive housing assistance for up to 12 months to give clients the opportunity to become self-sufficient.
We walk with people for a short period of time, but in that time, through intensive case management, they're able to take those opportunities and create lives for themselves that don't include homeless services.
The program has shown remarkable success.
What we know is that 87% of the people who have been served through the Choice program, through Open Doors, have made it over that hump. They have taken those opportunities and seized them, and they have created lives for themselves that include permanent housing.
The ultimate goal of Choice is self-sufficiency for their clients.
We want to provide those supports that enable people to live self-sufficiently. And so the Choice program is there for a period of time to provide those intense supports so people can go on about their lives in the way that they choose, but they've had the intense services for that period of time that they can take with them for the rest of their lives.
Choice also saves the state and local communities money. Studies have shown that providing a person with supportive housing and community-based mental health care is less expensive than leaving them unsheltered.
If you can keep an individual housed and receiving community-based services, and you can keep them out of a mental health crisis, then you avoid the impact that a mental health crisis could have on your law enforcement community, on your emergency rooms, on your hospital systems.
Choice was initially designed to make sure people exiting state psychiatric hospitals did not get discharged to the street, but it also serves those who have cycled in and out of institutions and those who have had no access to treatment because of their homelessness. Since it began, Choice has become increasingly effective. Last year, almost 93% of the people exiting the program went into permanent housing and self-sufficiency.
Choice works and works well because people have the supports that they need to become successful. That's why it works.